Hello everyone, my name is Dr. Ushna and I'm a skin and hair specialist. Today we talk about lasers. If you're tired of shaving, waxing and threading, then this video is for you. What are lasers? Lasers are basically the cosmetic procedure and they use a very high concentrated beam of light that targets your hair follicles. There are different types of lasers and you can use different sorts of lasers that depend upon the dermatologist choose for that and they have in their clinics. So lasers basically being used for the long-term hair reduction or semi-permanent hair reduction. Lasers are sort of different kinds: diode laser, Alexander lasers, Nd:YAG lasers, and IPL devices. Lasers are basically have been done for your face, arms, legs, underarms, private parts, for your whole body. You can have lasers if you don't have any other skin condition, and you just have to prepare your skin up. Like, you don't have to wax or thread your hairs before lasers. You can shave, not wax or not thread, because we want your hair roots intact for lasers. Lasers actually target your hair follicles that contains pigments. So if your hairs don't contain any pigment and they're white or gray, then lasers won't work on your skin, on your hairs. Lasers are very high concentrated beams, so they don't damage your skin. Lasers can be used for light skin tones and dark skin tones, and there are different devices that work on different skin colors. So it depends what type do you have and what skin color do you have. So your dermatologist or skincare esthetician decide the frequencies and points depending upon your color and type. Skin lasers. And how many sessions do you require for lasers? There are mostly 6 sessions recommended for lasers, but you may have to take different more sessions, more than 6 sessions or more than 8 sessions, depending upon the growth of your hairs. If you have a very high hair growth or very speedy hair growth, then you have to take more sessions. And you have conditions like PCOS and your hormone levels are disturbed and you have hirsutism because of the other conditions, then you have to take long or more sessions as compared to the regular ones. Lasers work on their hair follicles only, so you don't have to worry that it may cause damage to your skin. Mostly the intervals between the 2 laser sessions would be 4 to 6 weeks, and the gap increases with the passage of time as your hair growth start reducing, and due to that reduction we may increase the gaps between your hair laser sessions in future. Hair laser sessions are required mostly 6 in number. Your hair cycle is divided in 3 phases: anagen, catagen, and telogen. So laser hair removal will only work in the anagen phase. So if your hairs are not in anagen phase, then laser won't work, and you have to. That's why mostly number of sessions increases, because you may have lasers and some of your hairs are not in the anagen phase. Aftercares of the lasers are not that much. Maybe you have redness for some hours or for a day or two, and there are no potential any side effects of the lasers. They are very safe to use in clinics, and even if you're using IPL devices at home. Which lasers are most effective? Mostly clinical laser devices used in the clinics are diode lasers, Alexander lasers, and Nd:YAG lasers. IPL devices have been used in home, so they are very less powerful as compared to the professional lasers, but you can use them if you don't have any option for the clinical lasers. After lasers, you can moisturize your skin. You can use SPF, and you can use cooling devices or like aloe vera gel, and keep your skin hydrated. And you can use the icing method too if you are feeling any burning sensation. During lasers, you don't have any sort of pain, but you might feel some discomfort or rubber band stabbing pain. So that's all about the lasers, and if you want to ask any other question, you can comment in this comment section below. Thank you.